So I want to just touch a moment on the public-private partnership that emerged to really bring to life the requirements of the RAISE Act. A national foundation, the John A. Hartford Foundation, approached me about how they could be supportive of ACL's efforts in this area. I worked with them to develop a grant to the National Academy for State Health Policy to stand up a RAISE, the Family Caregiver Resource and Dissemination Center. The University of Massachusetts, Boston, and Community Catalyst were also key in helping us with the public outreach and information gathering that, were it left up to ACL and the federal government, for us to be able to go out and survey and conduct focus groups and listening sessions would have been a very, very labor intensive, would have taken us a very long time to get approval to do that. With this public-private partnership, however, we were able to expedite that process and really begin to inform the development of both the initial report to Congress as well as the national strategies. So here's just a snapshot of the level of public engagement that through this public-private partnership we were able to do. ACL issued in our Federal Register a request for information that was sent to the far and wide across the country asking for caregivers and other stakeholders to talk about their experiences in family caregiving, what real challenges they had, and what recommendations they had for how we can better improve services and supports to them, and how we can structure what would become the national strategy. We got over 1,600 responses, 75% of which came from family caregivers. And it was Community Catalyst and UMass Boston that then took all of that information and analyzed it, and from there developed focus groups and listening sessions to dig into some of the findings more deeply. Many of the advisory council members sat in on these listening sessions and focus groups because it helped inform the choices that they made in the development of the strategy later on. So we have a strategy now. We also provide a range of examples for potential performance metrics that states, communities, any of the sectors that are addressed by the strategy can look at to measure their progress. So the strategy really does promote a whole of society approach. It is a national strategy. It's not only what the federal government can do. And finally, it's not the first, this is the first national strategy, but it's not the last.